If you're over 60 and dealing with bloating, constipation, or feeling off after meals, don't just blame it on age or bad food. Australian gastroenterologists now warn that gut troubles after 60 can signal serious bowel disease, microbiome collapse, immune breakdown, and even dementia and depression. Today, you'll learn the 7 gut warnings older Australians dismiss as just indigestion that actually predict life-threatening illness, and the simple daily habits that can rebuild your gut, boost your immunity, and protect your brain.
The gut health revolution sweeping Australia in 2024 to 2025. Gut health became the one most searched health topic in Australia, with over 1.8 million Google searches, an 85% increase from the previous year. Searches for gut health supplements, probiotics, microbiome diet, and leaky gut have exploded, especially among Australians over 55. Why the sudden obsession? Because scientists now understand that your gut is far more than a digestion tube. It's a complex ecosystem of trillions of bacteria, fungi, and viruses, your microbiome, that controls not just digestion, but also your immune system. 70% of immune cells live in the gut. Your brain and mood. The gut produces 90% of your body's serotonin and communicates directly with your brain via the vagus nerve, the gut-brain axis. Your inflammation levels. An unhealthy gut triggers chronic inflammation linked to heart disease, diabetes, cancer, and Alzheimer's. Your longevity. People in blue zones, the world's longest living communities, have diverse, healthy gut microbiomes. But here's the problem. After age 60, your gut microbiome naturally declines in diversity and health. Add to that a lifetime of antibiotics, processed foods, stress, medications, especially acid reducers and NSAIDs, and chronic diseases like diabetes, and many older Australians are walking around with severely damaged guts. The result? Chronic bloating, constipation, diarrhea, reflux, fatigue, brain fog, depression, frequent infections, autoimmune flare-ups, an increased risk of bowel cancer, diverticulitis, inflammatory bowel disease, and even dementia. This video will teach you the 7 gut symptoms older Australians dismiss as just aging or something I ate, when they're actually red flag warnings of serious gut disease or microbiome collapse. You'll learn what's happening inside your digestive system, which conditions to worry about, and the evidence-based daily habits, diet, probiotics, lifestyle, that Australian gastroenterologists and longevity researchers recommend to rebuild gut health and extend your healthy years. What is the microbiome, and why does it matter after 60? Your gut microbiome is the community of trillions of microorganisms living in your intestines. In a healthy gut, these bacteria are diverse and balanced. Good bacteria outnumber bad bacteria, and they work together to break down food and extract nutrients, produce vitamins, like B12 and K, train and regulate your immune system, protect against harmful pathogens, communicate with your brain via chemical messengers. But after 60, several factors damage this delicate ecosystem. 1. Reduced stomach acid and digestive enzymes. Your stomach produces less acid, and your pancreas makes fewer enzymes. This means food isn't broken down properly, leading to bloating, gas, and nutrient malabsorption. 2. Medications. Long-term use of proton pump inhibitors, PPIs for reflux, antibiotics, NSAIDs, and other drugs kill beneficial bacteria and allow harmful bacteria to overgrow. 3. Diet changes. Many older Australians eat less fibre due to chewing problems, dentures, or convenience, and more processed foods, starving beneficial bacteria. 4. Slower gut motility. The muscles in your intestines slow down with age, leading to constipation and allowing harmful bacteria to ferment and produce toxins. 5. Chronic diseases. Diabetes, kidney disease, heart failure, and other conditions disrupt gut blood flow and bacterial balance. The consequences are serious. Leaky gut, increased intestinal permeability. The gut lining becomes damaged, allowing bacteria and toxins to leak into the bloodstream, triggering chronic inflammation and autoimmune reactions. Dysbiosis. Harmful bacteria outnumber good bacteria, leading to infections like C. difficile, chronic diarrhea, and bowel disease immune dysfunction. A damaged gut can't train immune cells properly, increasing infection risk and autoimmune disease brain effects. Gut. Bacteria produce neurotransmitters and inflammatory signals that travel to the brain, affecting mood, memory, and dementia risk. Why just indigestion can be deadly after 60. Older Australians are conditioned to dismiss gut symptoms. Bloating? I ate too fast. Constipation? I need more water. Reflux? I'll take an antacid. Diarrhea? Must have been something I ate. But persistent or worsening gut symptoms after 60 are never normal and always deserve investigation. They can signal bowel cancer. Australia has one of the highest rates of colorectal cancer in the world. It's the second most common cancer in both men and women. Inflammatory bowel disease, IBD, Crohn's disease, or ulcerative colitis, which can develop at any age. Diverticulitis, infected pouches in the colon wall, common after 60 and can lead to perforation. Sepsis and death. Celiac disease or gluten sensitivity can develop later in life. Chronic infections, C. difficile, parasites, bacterial. Overgrowth. Medication side effects, PPIs, NSAIDs, antibiotics, opioids. Pancreatic or liver disease. Early detection saves lives. Bowel cancer caught at stage 1 has a 90% 5-year survival rate. Caught at stage 4, that drops to around 10%. Real Australian stories. Gut symptoms ignored versus acted on. June 68. Adelaide ignored bloating for 2 years. June felt constantly bloated and uncomfortable after meals. She blamed it on getting older and eating too much. She started eating less and avoiding social meals. Her GP suggested an over-the-counter probiotic and dietary changes, but didn't investigate further. 2 years later, June developed severe abdominal pain and bleeding. A colonoscopy revealed stage 3 bowel cancer. She needed surgery, chemotherapy, and now lived with a permanent colostomy bag. If I'd pushed for a colonoscopy when the bloating started, they might have caught it stage 1. I thought I was just being a hypochondriac. Alan, 74, Brisbane, caught diverticulitis early. Alan noticed occasional lower left abdominal pain and irregular bowel movements. His GP ordered a colonoscopy, which revealed diverticulosis, pouches in the colon, but no active infection or cancer. Alan was advised to increase fibre, drink more water, and avoid NSAIDs. He made the changes and has had no further problems. I'm glad I didn't just ignore it. Knowing what's going on means I can manage it before it becomes an emergency. How to use this video roadmap, part 1. This section I entail you now understand why gut health is critical after 60, how the microbiome works, and why just indigestion can be deadly. Part 2, body. The 7 gut warnings. In the next section, you'll learn the 7 specific gut symptoms that predict serious disease. For each, you'll see what it looks like, what's happening inside, which conditions it signals, and when to seek help. Part 3, conclusion. Your gut healing action plan. In the final section, you'll get a step-by-step plan, what tests to demand, daily gut healing habits, diet, probiotics, lifestyle, when symptoms are urgent, and how to rebuild your microbiome. The 3 golden rules before we begin. Golden rule 1. New or worsening gut symptoms and never just age. If your bowel habits, comfort, or digestion have changed significantly over recent weeks or months, investigate, don't dismiss. Golden rule 2. Blood, weight loss, or severe pain equals urgent assessment. These are red flag cancer symptoms. Don't delay. Golden rule 3. Your gut health is trainable even if your microbiome is damaged. You can rebuild it with the right diet, probiotics, and lifestyle, but only if you start now. Part 2, body. THE 7 gut warnings older Australians ignore. 3,000 words. Warning number 1. Persistent bloating and abdominal discomfort after meals. What it looks and feels like. You finish a normal-sized meal and within an hour your stomach feels like a balloon. Your abdomen is visibly distended, tight, uncomfortable. You can't button your pants. The bloating lasts for hours, sometimes all day. You start eating less to avoid the discomfort, but even small meals trigger it. What's happening inside your gut? Small intestinal bacterial overgrowth, cybobacteria that should live in the colon have migrated up into the small intestine, where they ferment food and produce gas, low stomach acid, or digestive enzymes. Food isn't being broken down properly, leading to fermentation and bloating. Food intolerances: lactose, dairy, fructose, fruit, honey, gluten, or FMAPs, certain carbs. Intolerances often develop or worsen after 60 bowel cancer or other obstruction. A tumor partially blocking the bowel can cause bloating, pain, and changes in bowel habits. Which serious conditions does this predict? Bowel cancer, inflammatory bowel disease, celiac disease, diverticulitis, ovarian cancer. In women, bloating is a key early symptom. Key clues: it's serious. Bloating is new, persistent, and worsening, accompanied by weight loss, blood and stool, or severe pain. Bowel habits have changed: constipation, diarrhea, or alternating. You over 50 and have never had a colonoscopy. What to do? GP appointment within 1 to 2 weeks. Request stool tests, blood tests, including CA 125 if you're a woman and bloating is severe, and colonoscopy referral if you're over 50 or have red flag symptoms. Warning number 2, chronic constipation, less than 3 bowel movements per week, straining, hard stools, what it looks and feels like. You used to go daily. Now you're lucky if you go every 3 to 4 days. When you do go, stools are hard, dry, painful to pass. You strain, sometimes for many minutes. You feel like you haven't fully emptied. You might see blood on the paper from straining. What's happening inside? Slow gut motility, age-related slowing of intestinal muscles, worsened by inactivity, dehydration, low-fiber diet medications, opioids, anticholinergics, calcium supplements, iron tablets, some blood pressure drugs. Bowel obstruction, tumor, stricture, or severe diverticulosis, narrowing the bowel. Neurological issues, Parkinson's, diabetes, spinal problems affecting bowel nerves. Which serious conditions does this predict? Bowel cancer, diverticular disease, fecal impaction, severe constipation causing complete blockage, medical emergency, bowel perforation from straining. Key clues: it's serious. Constipation is new or suddenly worse, accompanied by blood, weight loss, abdominal pain, or vomiting. You haven't had a bowel movement in over 7 days despite trying remedies. Your abdomen is swollen, hard, and painful. What to do? If no bowel movement 7 days, severe pain, vomiting, emergency department now, possible. Obstruction or impaction, otherwise, GP appointment within days. Request abdominal exam, stool tests, medication review, and colonoscopy if indicated. Warning number 3, chronic diarrhea or alternating diarrhea and constipation. What it looks and feels like. You have loose, watery stools multiple times a day, or your bowel habits swing wildly between constipation and diarrhea. You feel urgency, cramping, and never quite empty. It's been going on for weeks or months. What's happening inside? C. difficile infection, especially if you've recently taken antibiotics or been in hospital. Inflammatory bowel disease, Crohn's or ulcerative colitis can develop at any age. Microscopic colitis, common in older adults, causes chronic watery diarrhea. Bowel cancer can cause alternating bowel habits, bile acid malabsorption. After gallbladder removal or with certain gut conditions. Medication side effects, metformin, diabetes drug, PPIs, antibiotics, magnesium supplements. Which serious conditions does this predict? Bowel cancer, inflammatory bowel disease, C. difficile infection, can be life-threatening. Malnutrition and dehydration, especially dangerous in older adults. Key clues: it's serious. Diarrhea lasting more than 2 weeks, blood, mucus, or pus in stool, fever, severe cramping, dehydration, weight loss, night sweats, fatigue. What to do? GP appointment within 24 to 48 hours. Bring a stool sample if possible. Request stool culture, blood tests, and colonoscopy referral. Warning number 4, blood in your stool, bright red, dark black, or hidden. What it looks and feels like. You see bright red blood on the toilet paper, in the bowl, or mixed with stool. Or your stool is very dark, black, and tar-like, melena. Sometimes blood is only detected on a screening test, FOBT, fecal occult blood test. What's happening inside? Hemorrhoids or anal fissures, common, usually cause bright red blood and are painful but not life-threatening. Diverticular bleeding, diverticular, pouches in colon, can bleed, sometimes heavily bowel polyps or cancer, polyps, precancerous growths, or tumors bleed as they grow, inflammatory bowel disease, upper GI bleeding. Stomach ulcer, esophageal varices, causes black, tar-like stool. Which serious conditions does this predict? Bowel cancer, Australia's second most common cancer. Stomach or esophageal cancer, severe diverticulitis with perforation, life-threatening bleeding, especially if large volume or black stool. Key clues: it's urgent. Large amount of blood or bleeding that won't stop. Black, tar-like stool suggests upper GI bleeding. Go to ED immediately. Dizziness, fainting, rapid heart rate suggests significant blood loss. Call ambulance. Any visible blood if you're over 50 and never had colonoscopy. What to do? If heavy bleeding, black stool, dizziness. Emergency department now. If small amount, bright red blood, no other symptoms. GP within 24 to 48 hours. All cases. Insist on colonoscopy referral. Blood in stool in anyone over 50 is a red flag cancer symptom and requires urgent investigation. Warning number 5. Unexplained weight loss and loss of appetite. What it looks and feels like. You're eating the same or less, but you're losing weight without trying. You've lost 5 kilograms or more over 3 to 6 months. Food doesn't taste as good. You feel full quickly. Your clothes are loose. What's happening inside? Bowel, stomach, pancreatic or liver cancer. Tumors cause weight loss through metabolic changes and reduced appetite, malabsorption. Celiac disease, chronic pancreatitis. Bile duct problems prevent nutrient absorption, chronic infection or inflammation. TB, HIV, chronic gut infections, depression or dementia can cause reduced appetite and weight loss. Which serious conditions does this predict? Bowel, stomach, pancreatic, liver, or esophageal cancer, advanced inflammatory bowel disease, chronic infections, severe malnutrition, increases fall risk, infection risk, and death risk in older adults. Key clues: it's urgent. Unintentional weight loss of 5 kg plus in 3 to 6 months accompanied by gut symptoms, fatigue, pain, or blood in stool, night sweats, persistent fever, difficulty swallowing. What to do? GP appointment within days. This is a red flag cancer symptom. Request full blood tests, stool tests, imaging, CT or ultrasound, and urgent specialist referral. Warning number 6. Severe or persistent heartburn, reflux, especially new or worsening after 60. What it looks and feels like. Burning in your chest or throat after meals or when lying down. Acid taste in your mouth. Difficulty swallowing. Chronic cough or hoarse voice. You've been taking over-the-counter antacids or PPIs for months or years. What's happening inside? Gastroesophageal reflux disease. GERD, stomach acid flows back into the esophagus. Hiatus hernia. Part of the stomach pushes up through the diaphragm, Barrett's esophagus. Chronic reflux damages the esophagus lining, increasing cancer risk. Esophageal or stomach cancer can cause new or worsening reflux, difficulty swallowing, weight loss. Which serious conditions does this predict? Esophageal cancer, stomach cancer, Barrett's esophagus, precancerous, aspiration pneumonia, from reflux into lungs. Key clues: it's serious. Reflux is new after age 55 or suddenly worse, difficulty swallowing, especially solid foods. Weight loss, vomiting blood, black stool. Symptoms: don't respond to PPIs. What to do? GP appointment within 1 week. Request referral for endoscopy, gastroscopy, to visualize esophagus and stomach and rule out cancer or Barrett's. Warning number 7. Excessive gas, foul-smelling stools, or fatty stools, steatorrhea. What it looks and feels like. You have constant, embarrassing gas. Your stools are very foul-smelling, float, are greasy or oily, and hard to flush. You feel nauseous or uncomfortable after fatty meals. What's happening inside? Pancreatic insufficiency. Your pancreas isn't producing enough enzymes to digest fat, often due to chronic pancreatitis, pancreatic cancer, or diabetes. Bile duct obstruction, gallstones, tumor, or stricture blocking bile flow needed for fat digestion. Small intestinal bacterial overgrowth, SIBO, celiac disease, or other malabsorption syndromes. Which serious conditions does this predict? Pancreatic cancer, chronic pancreatitis, bile duct cancer, severe malnutrition and vitamin deficiencies. A, D, E, K are fat soluble. Key clues: it's serious. persistent greasy, floating stools, weight loss, jaundice, yellowing skin or eyes, upper abdominal pain radiating to back, diabetes that's suddenly harder to control. What to do? GP appointment within days. Request blood tests, liver function, pancreatic enzymes, fat-soluble vitamins, stool fat test, and imaging, ultrasound or CT, to assess pancreas and bile ducts. Automatic Alarac Part 3. Conclusion Devamedia. Part 3. Conclusion. Your gut healing action plan. 3,000 words. You've learned the 7 gut warnings. Now it's time for action. How to test, heal, and protect your gut for the long term. Step 1. The Gut Symptom Tracker 3-day diary. Track for 3 days. Bowel movements, frequency, consistency. Use Bristol stool chart. Color, any blood or mucus, meals and symptoms. What you ate, when, and any bloating, pain, gas, or reflux within 4 hours. Medications and supplements, energy and mood. Gut health effects both. Bring this to your GP. Step 2. Demand the right tests for everyone with persistent gut symptoms. Stool tests, occult blood, FOBT, calprotectin, inflammation marker, culture, infection. See difference toxin if recent antibiotics. Blood tests, full blood count, iron studies, B12, folate, liver and kidney function, inflammatory markers, CRP, ESR, celiac antibodies. Colonoscopy, if over 50, or any age with red flag symptoms, blood, weight loss, family history of bowel cancer, additional tests if indicated. Endoscopy, gastroscopy for reflux, swallowing difficulty, upper abdominal pain. CT or ultrasound. If weight loss, jaundice, or suspected obstruction. Breath tests. For SIBO or lactose intolerance. Microbiome stool analysis. Emerging test, not yet standard but available privately. Step 3. The evidence-based gut healing diet. Increase fiber gradually. Target 25-30 g daily. Vegetables, fruits, whole grains, legumes, nuts, seeds. Fiber feeds beneficial gut bacteria and prevents constipation. Eat fermented foods. Natural probiotics. Yogurt, live cultures, kefir, sauerkraut, kimchi, miso, tempeh. These contain live beneficial bacteria. Include prebiotic foods. Food for your gut bacteria. Garlic, onions, leeks, asparagus, bananas, oats, apples. Prebiotics are types of fiber that specifically feed good bacteria. Adopt a Mediterranean-style diet, rich in vegetables, olive oil, fish, whole grains, linked to healthier, more diverse microbiome and lower inflammation. Limit or avoid processed foods, added sugars, feed harmful bacteria and yeast. Red and processed meat, linked to bowel cancer risk. Artificial sweeteners can disrupt microbiome balance. Excess alcohol damages gut lining. Stay hydrated. 6 to 8 glasses water daily helps prevent constipation. Step 4. Probiotic and supplement strategy. Probiotics. Choose multi-strain probiotics with at least 10 billion CFU, colony-forming units. Look for strains with evidence. Lactobacillus, Bifidobacterium. Take daily for at least 4 to 8 weeks to see benefit. Consult GP if you're immunocompromised. Digestive enzymes. If you have bloating, gas, or diagnosed pancreatic insufficiency, digestive enzyme supplements, taken with meals, may help. Fiber supplements, psyllium husk, inulin, or methylcellulose can help if dietary fiber is insufficient, but increase slowly to avoid gas. Vitamin D, omega-3, zinc, support gut lining repair and immune function. Step 5. Lifestyle habits for a healthy gut. Exercise daily. 30 minutes physical activity stimulates gut motility, reduces constipation, and promotes healthy microbiome diversity. Manage stress. Chronic stress disrupts gut-brain communication and worsens IBS, reflux, and inflammation. Try meditation, yoga, deep breathing, or counseling. Sleep 7 to 8 hours. Poor sleep disrupts gut bacteria balance. Avoid unnecessary antibiotics. Only take antibiotics when truly needed. Bacterial infection confirmed. When you do take them, follow with probiotics to rebuild gut flora. Limit PPIs and NSAIDs. Long-term use damages gut lining and microbiome. Work with GP to find alternatives or lowest effective dose. Quit smoking. Smoking damages gut lining and increases bowel cancer risk. Step 6. When to push for specialist referral if your GP dismisses your symptoms or doesn't offer investigation. Say, I'm concerned these symptoms could indicate bowel cancer or serious gut disease. I'd like a referral to a gastroenterologist for colonoscopy and further assessment. Insist on referral if you're over 50 and never had a colonoscopy, you have red flag symptoms, blood, weight loss, new symptoms after 60, symptoms persist despite initial treatment, you have family history of bowel cancer. Step 7. Understand your bowel cancer screening options in Australian National Bowel Cancer Screening Program. Free FOBT kit mailed to Australians aged 50 to 74 every 2 years, detects hidden blood in stool if positive. You referred for colonoscopy, do the test. Participation rates are too low. Early detection saves lives. Colonoscopy, gold standard for detecting polyps and cancer, recommended every 5 to 10 years for average risk. More often if family history or previous polyps. Step 8. If bowel cancer or serious disease is diagnosed, bowel cancer treatment. Surgery, remove tumor and affected bowel, chemotherapy, radiation, depending on stage. Survival is excellent if caught early. IBD, diverticulitis, celiac disease. All manageable with medication, diet, and lifestyle. Specialist gastroenterologist will guide treatment. Access support. Bowel Cancer Australia. bowelcanceraustralia.org. Crohn's and Colitis Australia. crohnsandcolitis.com.au. Step 9. THE 4-week Gut Reset Challenge. Week 1. Start 3-day gut symptom diary. Book GP appointment. Add 1 serving fermented food daily. Yogurt, coffee. Week 2. Increase fibre gradually. Add 1 extra serve vegetables daily. Start probiotic supplement. Walk 20 minutes daily. Week 3. Reduce processed foods and sugar. Add prebiotic foods. Garlic, onion, oats. Practice stress reduction. 10-minute meditation or deep breathing. Week 4. Review progress. Are symptoms improving? If not, push for specialist referral. Continue healthy habits long-term. Step 10. Remember, your gut controls more than digestion. Your gut is your immune headquarters, 70% of immune cells, mood regulator, 90% of serotonin made in gut, inflammation controller. Healthy gut equals lower chronic disease risk, longevity key, diverse microbiome equals longer, healthier life. Protecting your gut after 60 isn't vanity or minus FK. It's one of the most powerful things you can do to prevent dementia, depression, infection, autoimmune disease, and cancer. You now know the 7 red flag gut symptoms, what tests to demand, how to rebuild your microbiome with diet, probiotics, and lifestyle when symptoms are urgent, how to access screening and specialist care. In Australia, the only thing left is action. Don't dismiss gut symptoms as just age. Don't delay screening. Don't suffer in silence. Your gut is your second brain. Treat it that way.